everyone, and welcome back to Reclaiming Fertility Joy, Healing the Broken Spirit of Polycystic Ovarian Syndrome. I am your host, Corey Ray Kopax, registered nurse and women's wellness mentor and educator. And I am joined today by a wonderful doctor that I have met and got to know over the last couple of weeks. This is Dr. Jane Levesque. She is a naturopathic doctor and a natural fertility expert. She is passionate about helping couples get to the root cause of their infertility struggles and help them conceive naturally. Welcome, Dr. James. So happy to have you here today.
Thanks so much, Corey. Thanks for that introduction. I'm really excited to be here.
It's really been amazing, some of these conversations we've been having around your mission and how you are supporting women through their fertility process. And I would love to hear from you a little bit more and to share with the audience what your kind of philosophy is and how you're approaching these challenges with your clients.
For sure. I mean, to speak a little bit on kind of my philosophy and beliefs is I very much believe that pregnancy is a natural process. So when it's not happening, something is wrong and something is missing. And instead of thinking that you are broken or you are cursed and you are not meant to have children, we need to change that language to say things like, hey, what am I missing? What's going on? Who do I need help from? Or what is my body trying to tell me? What are these symptoms? So in the case of PCOS, a lot of the times we stop at the diagnosis. We stop at you have polycystic ovarian syndrome, and that is why you have the hormonal imbalances. That is why you have the insulin resistance, the thyroid, the inflammation, you name it, right? And then, of course, not ovulating on a regular basis, having the low progesterone that comes with that, the high testosterone. And so instead, it's peeling back some of these layers and really looking at what is the body trying to tell us? Because the body doesn't do anything without a reason.
Right.
And so it's adapting based on the messages that it's getting, whether it's externally or internally. And so my mission when I talk about root cause is really to understand what is that for this individual person that's sitting in front of me. There's many different kinds of root causes, and it's different for every person, although of course there are similarities. And that's something I think that we're going to cover today.
Absolutely. Yeah, we're definitely going to jump into these concepts of root cause and how to address them and how that plays a part in each individual case. I love that I kind of refer to you as like the big guns. Like you kind of come in when maybe people have made some changes, based on kind of general recommendations, and maybe they're just kind of starting this root cause analysis and they've made some shifts, but things still aren't quite improving or quite making sense. So you kind of come in and help support them with more targeted support for their individual case. Absolutely love that. And we need that so much in this space.
Yeah. And the thing that you and I talked about is it really depends on which phase you're in terms of discovering in terms of like how much empowerment you're looking for, where you are in your journey, like you're just becoming aware that maybe some of these things aren't normal versus these things aren't normal and you have been working for years on trying to reverse polycystic ovarian syndrome or whatever disease that you're struggling with. And so if you're just in the phase of, wow, I had no idea that this isn't normal, and I had no idea that there is a natural way to treat this, then you're in the phase of consuming information, which there's a ton of information online, and you're probably in the phase of a little bit of trial and error, where you're going to try something and see if it works for you. The main thing that I'll say for if you're in that phase is if something doesn't work, don't think that that's over and your body's broken and you're not responding.
Right.
It's actually just a sign that you need to try something else. And that approach, whatever it is, whether it's a diet piece that you tried or a lifestyle piece, sometimes it's just that it's not enough, as opposed to that was the only, because there isn't one thing that's going to fix everything. So let's say you had to change your diet and you started to eat 3 meals a day that were well planned, they were well balanced, you weren't snacking, but you still didn't lose weight. It's like, that's a bummer. I get that. And I've been there, but that doesn't mean that you don't need to do those things. It generally means you need to incorporate something else. And that's what I talk about, trial and error. Like, okay, I've tried this. and I feel really good about this. I've made some changes. I feel better. My energy's better. Digestion is probably better, but it's not quite enough. And
Mm-hmm.
so I see a lot of people giving up in that stage, where in reality, all you
Uh,
need to do is you need to actually just go deeper.
yeah. And sometimes when we're in that information consuming stage, right, and kind of these beginning
Mhm.
stages, it does feel overwhelming, and we can get very disheartened if,
Yes,
we see that person that's on social media that's had such great success with maybe cutting gluten or cutting out
totally.
certain things, or taking a certain supplement, and then we get disheartened when it's like, oh, that didn't work for me after a month or two. Well, there's a couple of things here. First off, it takes a little while for things. We say,
Yeah,
about 3 months before you start seeing. I mean, you'll see little changes, but really you don't know
yeah,
um, right away. It's not a magic pill. It's not an overnight. And secondly, you do tend to like kind of give up, or it can feel very disheartened, and you want to give up because you're like, oh, well, maybe maybe there's just no fixing me. Maybe it's just
that's it.
me, and that, I work with a lot of people kind of on that beginning stage, where this like transition between
Yes.
the healthcare, going through this traditional pipeline and stepping into this idea of, oh, well, maybe there's something I could do differently here. And I love that you're kind of here on this other side where people have made these changes and recognizing that those are two very different people. And that's
Yep.
okay. You need support in both those places. I
Sure.
absolutely love that you recognize that and are sharing that, because it's important to understand that this
Yes.
person who's just starting out is going to be in a very different spot than this person who's been making changes for 6 months, and how
Or
you
a year or two
or two
years or
years.
however
Yeah,
long.
exactly.
Yeah. And some of
Yeah.
it is tied to our teaching style. Some of it is tied to also, how our own personal experiences and what
Yeah.
worked for us and what didn't.
Hmm.
And so that's the thing that I really preach on my social media a lot,
Yeah.
is just because you've made those changes and you don't see a difference, it doesn't mean, first of all, that those changes didn't actually make a difference. Because I bet
Right.
you, if you ran some lab work and reran it from the time that you
Mhm.
started to the time that you are now, you're going to see some changes. And then, even though you're not seeing the physical changes, or maybe a big thing like pregnancy, then it doesn't mean that those changes aren't happening. And this is where I like to rely on the lab testing and some
Mhm.
more data tracking, so then we can get a little bit more specific to understand where is your body kind of lagging behind and what does it need the most support in, so we can make those tweaks, we can make those changes, and then you can actually start to see it. Because
Mhm.
pregnancy, right? Like, let's talk about pregnancy. It's like, I always say, it's like the SATs. You're taking a huge final exam and then seeing what the result is, right? So
Right.
if you keep failing that SAT or that final exam, would you keep taking the exam, or would you step back and say, hey, which section of the exam am I failing and by how
Mhm.
much? Like, what do I need to go back and study? So instead of, if you're in the phase of, I've been trying for years to conceive, I want you to, like, what are we really trying? Like, you're telling me that you're trying, you're having intercourse at the regular time at the, to me, I don't want to say that that's not trying. I get it, that is trying,
Sure.
but we're just get stuck in the cycle of,
Mhm.
I'm just doing the same thing over and over again and I'm expecting different
Different
results,
results. Mhm.
which feels really insane, because it is insane. But at the same time, you don't have anyone who's coming and helping you, right?
Right. Part
And
of
it's a
that feels
serious issue, right? And it's a
right.
serious issue that you do need help with,
Part of
is
it is
is the main point.
part of it is that we feel like we don't have the power to do that, because it's not that we're not getting supported in traditional medicine. They support us in the way that they know how, but you do
Yes.
feel isolated, like you don't have any power, like you're relying on these medications and relying on the procedures and
Yep.
things like that, when you don't realize, oh, there's things that I can do. And some of
Yep.
them are, I mean, some of them are more challenging changes than others, but some of them are as simple as
Yep.
just getting more sleep. I mean,
Yep.
we don't realize how big those like kind of components are, and until you start tracking specifically with labs, or start tracking with symptoms or how you feel, your dieting journals and things like that, actually taking note and seeing these changes, because the outward is usually the last part that we see. There's so
For
many
sure.
other things that change first, like how we feel waking up groggy versus not, or our joints hurting, or not feeling buzzed.
Irregular bowel movements, like that's a huge one that everyone underestimates. I'm like, hey, if you have 2 or 3 bowel movements a day versus just one, like without that's a huge difference in your health. That's
Yeah.
your ability to eliminate toxins and ability
Mhm.
that's to get rid of old bad hormones, right? And your ability to make new
Mhm.
ones and absorb, like that makes a really big difference.
It does. And there's so much. I love that you bring up the GI stuff, because there is so much connection to our guts and hormones and PCO, and how those interact with each other in terms of
Sure.
our inflammation, and how our bodies respond to that process. So that's a fantastic kind of segue into talking about root causes. Let's discuss a little bit more about these specific root causes, what you see the most frequently in your practice, and how you go about addressing those issues when you discover the primary root cause of PCOS in your patients.
Yeah, for sure. So I think the main thing first that I really try not to put the diagnosis, even though my patients are coming to me already with a diagnosis,
Yeah.
I try to really look at what are the symptoms and what is the body
Mhm.
trying to tell us.
Yeah.
Because in the conventional world, again, we're labeled with the sticker of PCOS because it allows them to identify and understand your case without you having to repeat your history over and over again. We can expect to see that LH and FSH ratio to be off. We can expect to see testosterone to be high, inflammation high. We can expect to see the blood sugar dysregulation, although not everybody, right? The same with
Mhm.
thyroid, not everybody, but you might have more of the hypothyroidism with a PCOS. And so for me, it's really about let's just look at what the body's trying to tell us. And
Mhm.
then we're digging to understand why. And so the whys, I say there's 2 types of lab work. There is lab work that's going to tell us what's happening. And then there's lab work that tells us why it's happening.
Mm.
The what lab work is your blood work, your hormone analysis, micronutrients, so vitamin D, B12, like, literally any vitamins that you're running, fatty acids, amino acids, all that stuff is going to tell, even food sensitivities.
Mhm.
That's all telling us what's happening in the system. It's not really getting to the why. Like, why would you have all these food sensitivities? Or why do you have low iron or low B12 or low progesterone or high testosterone? And so from a treatment perspective, if you're only treating the what, you're grabbing the low-hanging fruit. And I like treating the what at the very beginning because it allows you to feel better fairly quickly so that
Yeah.
we can continue to work on the why, right? Because if we don't treat the why, you're going to be stuck taking the inositol, the fish oil, the probiotics, whatever else that was you've kind of found and recommended because you have PCOS. You'll be stuck taking that for quote unquote the rest of your life. And that is
Mhm.
managing PCOS versus treating it. And
Absolutely.
so what are the tests that are going to show us why things are happening? This is where we look into the gut. And this is a stool analysis where we're literally are just going to look and see if you're absorbing, digesting your food, a little bit of a microbiome imbalance. So even though the stool analysis, they won't pick up everything, they're going to give us an idea if there is a dysbiosis. A lot of inflammatory markers will show up, even things like beta glucuronidase to see if there is an imbalance in how you're metabolizing estrogen.
Mhm.
So and then like if there's any what's it called, gut lining barrier issues, right?
Mhm.
So that leaky gut picture, we're going to be able to see that through the stool analysis. And the gut is the epicenter of your health. So if the gut isn't working well, and now I'm not talking just about your colon. Everybody always thinks about the gut like, oh, I poop twice a day or 3 times a day. You have to think about your small intestine, which is that any bloating or discomfort that you get when you're eating and the food is digesting. You have to think about your stomach, so any acid, heartburn, anything that feels like a rock is sitting in your stomach when you're eating. You then have to think about your liver and your gallbladder because that's where we produce bile. So if you have issues digesting fats, right, and even if you have any hormonal imbalances, we know the liver is struggling.
Mhm.
And then you look at the pancreas, that also helps us with our blood sugar, right, regulation. And then you look at the mouth and what's going on, like that's your digestive system. right? Because if you have a lot of cavities, if you have a lot of gingivitis,
Mhm.
there are things that are, and you have the best dental hygiene, I'm telling you that it's coming from the gut. It's coming from your stomach. There's an imbalance in your, right? Whether it's H. pylori, you don't have enough acid, you have too much acid, whatever it is, your gut is not just your colon. And so that's why a lot of weight goes onto the gut, because
Mhm.
literally every symptom can be connected to the gut. In the alternative world, that's a very, I think, common. Every practitioner should be treating the gut if they're treating hormones, because essentially they're wasting your time.
Absolutely, because if you, I mean, it's kind of the same of just putting on band-aids on the symptoms. I mean, while it is treating, addressing the symptoms, which is a step further than a lot of people, you know, go with.
Totally.
But it, if you're just getting that surface and not getting to the really deep root causes like your gut,
Sure.
then you're not, you just kind of getting stuck in that pattern, like you said. So that
Well,
is,
and to use this as an educating point for
yeah,
people
please.
is to help you figure out a good practitioner versus from maybe a beginner practitioner, right? So, and it's not like I used to be a beginner practitioner too. And so there's nothing wrong with that. But when my patients left me because they didn't have good results, I knew that I needed to get better as a practitioner. And so it made me want to learn and educate and understand more, because I didn't come out of school starting to
No.
run all these tests and look at root causes and do all of that. I started doing that because I wanted to get my patients results. And when they didn't get results, I was frustrated,
Sure.
just because I myself, when my journey with having IBS and anxiety and
Mhm.
not being able to just fix your diet and exercise, because I already did that and it didn't work.
Right.
And so I knew that I had to dig deeper because the diet and the exercise wasn't working. And it wasn't that I wasn't putting effort in, it's that I was missing something else. And for me,
Right.
it was the gut was a huge component. And so if you're looking for a practitioner, that's a good way. Like if they're not addressing the gut at all and they're telling you they're going to balance your hormones, I would be questioning their methods.
Hmm.
I would be questioning their methods, and I would be under trying to really understand, like, now as a practitioner, I can tell when people are going to miss something, right?
Sure.
And I'm sure people who I mentor from can tell when I'm missing something and they're
Right.
helping me learn and work. So that's just for you. If you're working with someone, you're like, I don't feel like I already worked with somebody and I didn't get any results.
Hmm.
I went through like 7 naturopaths before I found the one that like really healed me. So most of us give up way too quickly on this journey before before we're right there to get the results. And we almost have to get that experience in order to be able to recognize a good one. It's just like dating.
Almost. Yeah, it
It
is.
would be really great if you met your soulmate on date 1,
What?
but highly unlikely.
Is that realistic? I think it's so interesting. We will shop around for cars, we will shop for computers
Mhm.
and phones
Yes.
and all these things, but we, for some reason, have this block in our mind about shopping for healthcare
Yes.
providers. First off, making sure they line up with our values, making sure that their skill set is going to be able to support us where we are at in our journey, and
Yes.
having those conversations instead of just settling because they're 5 minutes away, or just
Totally.
what other reasons we do. I don't know, it's a society thing, a cultural thing. It's so fascinating to me
Yep.
that that's like that, but it is. And so I love bringing this conversation up about advocating for yourself. You are the person who is in charge of your health, and if you feel like you're not getting the care that you need to support your individual case, it is time for
Yep.
you to find a different provider. And that is okay. It's okay to do that. And I want people to
Totally.
know that.
Yes,
Um,
no, I'm so glad that you brought that up, because it's exactly it. You have to shop for, and that takes some awareness on your part, and it also
yes.
takes some responsibility in terms of
Mm-hmm.
you going out and learning this content. So then when the doctor in front of you is sitting, like I remember when my doctor told me you can be on birth control for the rest of your life. And I was like, I wasn't going to say anything because I was 15 years old and this guy was 40 years old and like obviously a doctor. I was just, but
Mm-hmm.
deep down, I was like, yeah, that's weird. Like, I don't believe that. And guess what? I switched doctors. And even
Yeah.
though I went on birth control, I felt better because I felt more understood and it was okay. Right. And I did that as a 15-year-old,
Yeah.
which now when I think back on it, I was like, good for me. But it's, you
There's
can do that. Yeah,
the recognition of that power dynamic. And this is something I became
totally.
very aware of as a nurse, was I was
Yes,
watching these interactions between practitioners and patients. And I'm standing here kind of, I'm in a different role. I'm not diagnosing, but I am certainly supporting what we're doing
certainly.
here. And I could see this interaction and the power, and it's so deeply embedded in us. And so this is a
Yeah,
huge thing, a mission I have put forth, is like, I want to teach people how to advocate for yourself and how to stand up, how to answer these questions, and to find the right care provider for you. And that's a
certainly.
huge reason for why the summit even exists, is because of
Yeah,
that point right now. So I'm so glad you brought this up. It's such a huge point.
for
Um,
sure. I
I
want to
would,
do finish the second piece of the why
yeah,
test, if you will. So the gut was the main, and then the next thing is environmental toxins. And
oh yeah,
so this is a huge topic, and actually a lot of the root causes that I see is the load, the toxic load that our
mhm,
system has. So this is a simple urine analysis that will literally look at heavy metals, mold, all the environmental toxins like BPAs and phthalates and parabens, volatile organic compounds, just be able to show us how much your system is excreting.
mm,
Because if you're excreting really high volumes, your system is working overtime.
yeah,
And there is such a huge connection. There's been so many studies and research over the last 50 years, even 100 years, around environmental toxins. And I know that for some of you, like some of my patients will say things like, well, I've already switched out all my products and it didn't make
mm,
any difference. And so it depends on, number one, which products you switched, how far, and like there's also a list of priority. For
sure,
example, we get exposed to a lot of stuff in our water. And so if you
mm,
don't have a robust water filter, but you have switched out all your makeup, you're putting your efforts into the wrong
mhm,
thing. So
yep,
I find that my job is really to help you put the effort, because the environment can be really overwhelming.
mm,
And then when you can see it, sometimes it's not current exposure, sometimes it's past exposure. I have
yeah,
patients, whether it's PCOS or endometriosis or anything that has this endocrine disrupting
mhm,
component to it, who've grown up with parents who smoked inside the house,
right,
who've grown up in really old houses with a bunch of mold,
old,
who've
mhm,
gone, it's when you see it on the test and the body is excreting these crazy amount of toxins, we don't even know how much it's storing. This is just how much it's capable to excrete at this point in time, if you will. We know that there is a deeper issue going on.
mhm,
And so when the body starts to form cysts, or when it starts to form adhesions, or when it starts to form any kind of scar tissue, or what, we have to ask why. Why
yeah,
is it doing it? Even with things like fibroids, it's the body's trying to encapsulate, whether it's pathogens
mhm,
or toxins. And then we're seeing the nutrient deficiency. I
right,
think a lot of practitioners are really focusing on the nutrients. They're like, you're low on these nutrients. You need more B12, you need iron, you need vitamin C, you need glutathione,
mhm,
you need CoQ10. And then you have 500 things that you're taking and you're still not
mhm,
feeling.
right,
And then you're saying things like, well, natural medicine doesn't work, vitamins don't work.
mm,
It's not a nutrient deficiency, it's a toxicity that's causing the nutrient deficiency. And so
right,
until you address the toxicity, and whether it's current or past, we have to help the body get rid of it. And all of
mhm,
a sudden, you see the normal function of your endocrine system restore, of your digestive system restore, including the liver, including,
mhm,
right, your kidneys, your lungs, like all these detoxification organs that have been working over time. When you see those restore, and I'm not saying it's a quick fix, it's
no,
yes, getting rid of stuff in the environment, it's learning how to detox, it's, but you start to feel significantly better. And then of course we're seeing those improvements
right,
on the ultrasounds, we're seeing those improvements on your blood work. All of a sudden the nutrient deficiencies are coming up, because your body doesn't have to need all these nutrients just to stay around, right, to
right,
just be able to function throughout the day. I used to do a lot of IV therapy back in the day when I practiced, and I would think, oh my God, I'm going to pump this person full of nutrients. I'm going to give them so many, and they're going to be better. And we're going to
yeah,
do it for 6 weeks, and then, or we're going to do it for however long, and
uh,
they would be back. They would be back a couple weeks later, just being just as tired.
mm,
And that's when I started to really dig into root causes. I'm like, I'm missing something here. There's
mm,
no way that this person I've been putting so many vitamins, I'm going directly into the vein. that means we're bypassing the
The
GI tract.
digestive system.
Yeah, we're going right into the bloodstream, and somehow still they wouldn't get better, and they would crash. And so that's how it got me onto the cell core guys. They're really, groundbreaking in detoxification, and then really starting to look at toxicities and understanding what is in our environment and why are so many people sick, and therefore why are so many people struggling with infertility.
Right. And that's absolutely fascinating, and something we certainly need to make people more aware of, is that it's not necessarily that you're not intaking enough, it's that your body only has so much energy to do the processes, and it's going to
Yes.
prioritize those processes in order to maintain homeostasis. And so
Yeah.
it's like having 27 tabs open. You've got music playing, you've got downloads and uploads and things like that. And so fertility and, those things kind of go down on the list when your body
Sure.
thinks it's in a
In high
being
stress.
poisoned. Yeah, it's stressed. It's
Totally.
getting chased by a tiger and poisoned by its environment all at the same time. Like, fertility is the last thing that your body is going to do. So it's not that your body is not working for you. It's like changing this mindset here. It's that your body is trying to tell you it needs different support than what you've been doing. It's
Yep.
not, it doesn't hate you. It doesn't, oh, my
Yep.
body doesn't want me to get pregnant, or, and you kind of pitch
Sure.
yourself against it in your mind. But at the same time, it's like your body actually is just trying to maintain its function, and it's only got so much bandwidth. It only has so much memory, like a computer does, to be able to operate. And
For sure.
so the best
Yeah.
thing we can do is acknowledge that, and then start identifying what is it that's taking up the most bandwidth, what is it that's taking up the most, address that, and then go from there. That's
For
really
sure.
what root causes is about. That is such a fantastic conversation about that. And I would love to kind of shift gears just a little bit and talk about, we talk a lot about fertility and getting pregnant, but I want to talk about staying pregnant.
Totally.
So staying pregnant, and statistically speaking, we know that the average woman, or average rate of miscarriage for women without PCS is about 10 to 15% in the general population. But we've seen some studies that it's upwards of 30 or even 50%. It's much higher recurrence of miscarriages with women with PCOS, whether they're going through natural fertility or going through with fertility medications or IVF. So
Yep.
let's talk about how your thoughts on how PCOS affects our ability to maintain healthy pregnancy, and how we can change this conversation and start seeing that part as an important component in treatment for our patients.
Yeah, for sure. It's a great, it's a great and important thing to talk about, because again, I see a lot of miscare, mistreatment here. I have a lot of patients,
Absolutely.
if they experience 2 miscarriages, their doctors still won't even look at them until they've had 3.
It's 3,
And so,
yeah. The
and they
magic
won't
of it,
even run the basic lab work.
insane that is
Yeah,
happening.
it's literally happening to 2 of my patients right now, and where I'm sending them for some lab work. They really had to advocate, and and when I say advocate, like, they had to demand it.
Yes,
It's like, I'm not walking out of this office until you
until
do
you,
this.
absolutely.
Which is a very hard place to be when, number one, you're in the first trimester, you're already feeling anxious and overwhelmed. And then you're now having to ask authority, who should be the ones telling you what to do. You're demanding it. So it puts you in this weird position. But basically, any condition that is going to mess with our endocrine system is going to predispose us to having a miscarriage, because pregnancy is a really big hormonal shift. There's a lot of things that happen, right? Your progesterone has to rise and stay high for the entire time of the pregnancy. It's a progestation hormone, right? Progesterone, that's what that means. And so a lot of women with PCOS are not ovulating, which also means that they have low progesterone, because they're not ovulating on a regular basis, or that quality of the egg isn't good because it's multiple follicles that are getting attention, as opposed to one follicle that can grow to a large enough size in order to actually ovulate. So there's a couple components there that why PCOS women are more predisposed to it, is because you have to look at the quality of the egg, And then that's going to directly tie to then the ability to produce progesterone, right? So when we don't have good progesterone numbers, it usually means that that corpus luteum, when that egg was released, that corpus luteum, if the egg was really small and the ovulation was premature, you might not have, you might have fertilization that happens, but there's not enough genetic component, there's not enough energy and nutrients in, whether it's in the egg or actually the sperm as well, but you know, we're talking about just PCOS, there's not enough. And so genetic malformation can happen. And all it takes, there's so much replication that happens within those first couple of weeks, that it's just one replication that goes off and all of a sudden that fetus becomes not viable.
And viable.
You know? And so miscarriage for the most part is there because the body wants to carry to term as much as it can. So when it's not doing it, it's not that it's failing you, it's that something is missing in order for it to be able to do that. And sometimes, whether it's a thyroid issue, whether it's a progesterone, or it's an environment, so like we have infections that are low grade and chronic. You know, I just had a patient with an IUI that I'm onboarding, and they said, oh, we noticed a little bit of an infection in your cervical mucus. She has zero symptoms. She has zero symptoms. So there's a lot of, but she has a lot of fatigue, and we see nutrient deficiencies on her blood work. So there's a lot of stuff that we're just not aware of that might be quote unquote going on. And so that's understanding your body and understanding your symptoms before you even conceive. So I always recommend, because after, you know, I only had one miscarriage and that threw me in for a loop.
Yeah.
And so I can't, like, I just am so passionate about helping women advocate for themselves when it's like, you do not have to wait for your third miscarriage to see if your progesterone levels are low, or if your thyroid is sluggish and maybe you need to be on medication in order to help your system. But ideally, you would get a really good health assessment before you got pregnant. And I know that that takes patience. And I know that that also takes courage to look under the hood and say, man, what's going on in here? And a lot of people are scared of what they're going to find, right? They're scared that, oh my God, what if I find something and it means I have cancer? And like, that's the worst thing, because we are on Mr. Google now. And
where we
or
go.
what if I find something and I can never have kids?
Yeah.
And so but that also comes with a lot of anxiety. And so to me, it's like, hey, I know it's really nerve-wracking to find out what possibly could be wrong, but there's very little, like 1% or maybe 2% of things that are actually not fixable.
Right.
Most of them are. Even like PCOS and endometriosis and all, right? Like I see this in my practice all the time.
Yeah.
And it's not, you have to have the courage to look under the hood, so then you don't have to pay it later.
Yeah.
With once you're pregnant and having the miscarriages and all that jazz. Because yes, you can advocate for higher like make sure you get progesterone. You can advocate for thyroid, but thyroid medication if that's what you need. But in reality, it would be so great if we could get our health, both of our partners, just really good assessment, so we can kind of see what our fertility journey would look like.
Right.
And it's not this mysterious concept. Like when I look at someone's blood work and we're so close, I can and literally when I checked her lab work after, you know, we've been working together for 8 months, I'm like, we're so close. Yeah. And it's like, how do I know? Because I can see the hormone levels. I can see the inflammation down. I see the blood sugar regulated. How does she know? Her eyes are glowing. Her hair stops falling out. She's sleeping better. Her menstrual cycle, right? Like we don't know when it's going to happen, because there is that component of
there's
unknown,
the
right?
unknown.
Yeah, the unknown. But there is probability. Yeah. And we got to put that probability on our side.
It is, this topic, it always, I mean, I do kind of fill with emotion when I talk about this, because I feel it for those patients that have experienced even one miscarriage, but 2 or 3 before somebody even just looks at their progesterone in their luteal phase, just doing a blood test just to see what that, like one little piece that could make the difference. I mean, of course, there can be other things going on, but just even it could just be that one thing And the fact that it takes so long for us when we're going through that traditional pipeline, um, to even get that part done is
Yeah.
it's gut wrenching. It is so gut
Yeah.
wrenching. And if there's anything I can tell people is that if you are experiencing or have experienced miscarriages on top of all these other things with your PCOS, find a healthcare provider that will listen to what you say and that will
Yeah.
figure out and look at it. And I know sometimes it's scary, like you said, it's so scary to kind of look under the hood because of the unknowns of what this could be. But statistically speaking, it's probably something that it can be addressed much more easy than just and so having that knowledge gives you power back. It gives you the
Yeah.
control back and the confidence back in your health in order to make those changes and to have those things supported if you need it.
Sure. And I think some of that fear is really from kind of the conventional system that like you're normal, you're normal, you're normal. Oh, you're broken, you need meds, and that's the only thing. And so it
There's
feels
so much
very
in
out of,
between.
yeah, it feels very out of control because you're like, I guess I was normal and then just something happened and I developed diabetes or PCOS and it's
And
or cancer, right? Like it
there's
takes
years,
decades. It
years
takes,
in between
yeah,
that.
exactly. And how do you know that you're developing, you're on the path of developing disease versus improving your health? Well, how do you feel? Are you carrying extra weight even though you're
Mhm.
eating well and exercising? Are you sleeping well? Do you have energy to do the things that you want to do? Are you always moody? Do you have white cervical fluid production? And do
Mhm.
you know when you're ovulating or you have no idea what's going on with your menstrual cycle? And it's really painful and crampy and you get severe PMS. Those are all signs that your body is already not quote
Mhm.
unquote adapting. And so then you can start to support it with diet and lifestyle and supplementation. And then if if you just do diet and lifestyle changes and that works for you, that's fantastic.
Yeah.
Then just keep doing that, right? But
Yeah.
if you're starting to feel that you're stuck, all that means is you just need more help
Yep.
versus you got to give up on yourself.
Yes. Yes. You just means you need more help. It does not mean you're broken. It does
Yep.
not mean you're broken. It just means that you need to dig a
Yes.
little bit deeper and find somebody who will dig with you, to take your hand, to lock arms and say,
Yes.
we are going to find what this is.
For sure.
And that is so empowering, to feel that, because it's not all is hopeless. Not all is, is
For sure.
gone. So
Yep. For sure.
um, well, this has been an amazing conversation, Dr. Jane, and I am so happy that we've been able to talk about these really important topics that I feel are essential for those with PCOS and struggling with fertility to hear and to know that they
Yep.
are not alone and that they can restore their confidence. So, of course, Dr. Jane has a gift for you. Everybody that's here attending the summit is titled Why You Aren't Getting Pregnant with PCOS. You'll see the link after the interview. Make sure you go check it out. You'll see it in the email. Um, and then, of course, Dr. Jane, how can people get a hold of you if they want to ask you some questions or work with you?
Yeah, for sure. I mean, I'm really active on Instagram, so at Dr. Jane Levesque is where you can find me. And honestly, give me a follow, send me a message, tell me what you learned, what was really inspiring. I have a podcast, Modern Health with Dr. Jane, and all those links are within Instagram as well. And my podcast is a really great hub of information for those of you who are looking to just learn a little bit more about your body, like how to eat with a menstrual cycle, how to exercise with a menstrual cycle,
Mhm.
environmental changes, the mitochondria and fertility, PCOS, and how that's all tied. Because again, my goal is to really help women and couples understand that if pregnancy is a natural process, and now all of a sudden 1 in 6 couples are struggling to conceive, and they're predicting that number to go 1 in 2 in the next 20 to 30 years, which is not that far away, you guys.
No.
We have to start doing things now. And, if there's anybody who is younger listening to this, like you're in your 20s and you're not even thinking about having children because you just want to fix your health, it's like that's the prime time for you to
Yep.
start doing that, because then when you are ready to conceive, it's not going to be filled with anxiety or fear. You're going to feel way more in control of your journey. So Dr. Jane, at Dr. Jane Levesque on Instagram and Facebook, and also on TikTok, but Instagram is kind of where I'm at. And like I said, check out my podcast, come say hello, and I'll point you to the right resource, because I know that there is a lot. Because let's learn, let's educate, and kind of let's change the conversation.
Absolutely. So, well, thank you for that. And I'll make sure that yours, all your handles are listed as well. So I want to leave our guests with one last piece of insight and inspiration from you. So what's one inspirational thing you would say to someone who has PCOS and is struggling with their fertility now, to kind of bring them back to a sense of hope and joy?
I think this is a hard one, because it depends on where the person is, but sometimes it feels hopeless because you wish you would have started earlier. And the quote that I really like is like, the best time to plant a tree was 10 years ago. The next best time is now. And so if you're feeling anxious or hopeless or overwhelmed with the whole experience, the best way to actually deal with that is action. You're always going to feel better when you're doing something about something. Even though it might feel unproductive at times, you're still doing something, and that feels better than sitting still when it comes to fertility. Right? So it's okay to feel the emotions that you do and give yourself the space to feel them. But the best way for you to actually move through them is to do something about it. And whether that's listening to a podcast, or reading something, or changing up your diet, or starting to exercise, or interviewing some practitioners, whatever that may be, you trial and error here. You'll know right away if you feel good doing it versus, now this feels like a waste of time. Listen to that voice, because you're intuitive. You're intuitive, and you know when something is. I have people all the time tell me, oh man, my doctor doesn't listen to me. And I'm like, why are you with that doctor? Go with somebody else. Right. And they're just like, I never thought about it. I'm like, well, it's okay. Like, it's like dating. It's just like dating. You would never sit on a date with a person in front of you who was abusive, who did on the first date, right? You'd probably walk away. That's the same thing here, is you want to really pay attention to how you feel when you're with anybody, but especially with your practitioner, because it's a vulnerable space. And so they need to be able to hold that space for you. Otherwise, you're going to be filled with even more anxiety.
Living through that confidence in yourself, and knowing that, trusting yourself and trusting that voice, and understanding that the best way to move through fear is through it, is action. It's making a step forward towards the direction that you want, that aligns with your values. So thank you so much, Dr. Jane. It's been absolutely a pleasure, and we'll talk soon.
Thanks.